Well, hello everyone, welcome back. We will continue with our series to plot differences between ulcerative colitis and Crohn's disease today. Now, this is also a very commonly asked question for 5 marks or in your short answer questions. So, ulcerative colitis is ideally a chronic inflammatory disease limited to the colon and rectum, whereas Crohn's disease is an inflammatory disease that can affect any part of the GI tract from the mouth to the anus. Then, the site of involvement in ulcerative colitis is only confined to the colon and the rectum, whereas, like we saw in the definition, Crohn's disease can happen in any part of the GI tract, and the most commonly affected site of involvement is terminal ileum and colon. The distribution of lesions of inflammation that occur in ulcerative colitis are continuous, and the involvement is starting from the rectum and then it extends proximally. In a Crohn's disease, the lesions are discontinuous. Hence, we see them as skip lesions with normal segments in between. The depth of inflammation or involvement of the layers in the intestine is limited to the mucosa and submucosa in ulcerative colitis, whereas all the layers of the bowel wall are affected in Crohn's disease. Now, when we do a colonoscopy to find these inflammatory diseases, the pattern of inflammation in ulcerative colitis is diffuse. There is loss of vascular pattern, the ulcers are superficial, and there may be pseudopolyps present. When we do a colonoscopy in a patient of Crohn's disease, the ulcers are aphthous. There is a cobblestone appearance. Now, this is a very important differential diagnosis. There are deep linear ulcers as compared to the ulcerative colitis, and there can be strictures as well as openings of fistula. When we take a biopsy in ulcerative colitis and do a histopathology, we see that there are crypt abscesses, goblet cell depletion, and mucosal inflammation. When we do a histopath in a Crohn's disease, we see that there is a non-caesating granulomatous, which is very specific, and transmural inflammation, that is, there is involvement of all the layers of the mucosa. The complications that can happen in ulcerative colitis are a toxic megacolon, perforation, and it has a high risk of developing into colon cancer. The complications that we see in Crohn's disease are fistula, abscesses, strictures, malabsorption, and perforation. Some extraintestinal manifestations in ulcerative colitis are primary sclerosing cholangitis, arthritis, uveitis, etc. In Crohn's disease, what we see is arthritis, uveitis, skin lesions, as well as fistulas. The age of onset of ulcerative colitis is more common in 15 to 30 years of age, but we also see it in older patients than 60 years old. Whereas Crohn's disease can happen at any age, but the peak incidence is seen in the age of 15 to 35 years. There is an increased risk of colorectal cancer in ulcerative colitis, whereas the risk of cancer is slightly less as compared to ulcerative colitis in Crohn's disease. So remember, in ulcerative colitis, the lesions are continuous. It involves only the rectum and colon. The layer that is involved is only the mucosa, and the risk of cancer is high. In Crohn's disease, it can happen anywhere in the intestine. The lesions are discontinuous, therefore, we have skip lesions and cobblestone appearance. There is a transmural complications are more here. So bloody diarrhea is more common in ulcerative colitis as a clinical features, whereas in Crohn's disease, we see abdominal pain and weight loss as a prominent clinical features. See you next time. Bye-bye.